10 years ago, I attended a meeting involving North East Health and GoTAFE. At that meeting, it was the skills shortages, both current and impending, in health and community services was raised as a major issue. We, as a lens, saw this as an opportunity to work with North East Health and ultimately GoTAFE and schools to provide pathways into health for young people in this region.
Having the skills within regional Victoria is a bit of a challenge, and certainly, we are starting to experience staff shortages. So having pathways through the schools is extremely important, and also having pathways within the organisation to develop up and transition is critical as well.
This particular program at North East Health was one of the first in the state and unique in a number of ways. Students were basically treated as hospital staff, and the students were exposed to the breadth of opportunities across the whole of North East Health.
I'm studying a Cert 3 in individual support, which will be a PCA at Allura Aged Care Facility. The best thing about working at Allura is the training that you need to know, and they will teach you different and new things. It's going to help at the end of Year 12 when I finish school, and I can go and work in aged care, and then it'll help with nursing, so I already have some skills.
The staff are really crucial to the success of the program at the hospital. They mentor, they provide the training in the skills in the workplace that the students need for this particular certificates that they're undertaking.
So that they're being mentored in a way that they can identify pathways to get places, but also the possibilities.
If they can be exposed to an enormous variety of professions at a young age, it informs their choices for the future.
Kids often think health is nurses and doctors, but in this case we saw examples of kids that started to look at some of the allied health areas, physiotherapy, those sorts of things. We saw that in the outcome of kids going from their first year into their second year, and the high percentage that then went on to do further study and careers in the health and community services area.
Schools are finding it very difficult and challenging to say what are the future needs of the workforce moving on. So what does a hospital need? We can't make assumptions about what that is. So one of our pieces of work that this program is so important and successful is that there's partnerships between the community and the school and the workforce here. So the organisation of the hospital are working with us to say, these are our needs, and they offer us the support in terms of saying, these are the vet workplaces we can offer. They can link into us, and so we've got a partnership of education of each other about our needs. Are we offering what the kids need moving forward?
Since the commencement of the traineeships in 2014, the school-based traineeships, they have been extremely beneficial in encouraging and in guiding local students to explore career health pathways. As a result of that, we've had, in the 3 years, 24 students participate in the program and graduate. And the real benefit of that has been that North East Health has been a direct recipient of that, and we've actually employed a number of these students into business administration, supply and logistics roles. Additionally, many of these students have gone on to further education in health career pathways, but also some have been directly employed into local employers. Again, a fantastic benefit.
I guess as a workforce development program, it enables us to address some of our workforce issues and recruitment to specific areas within the organisation. It also enables us to grow young people within our community and who will hopefully stay local.
It is critical that NHW has school-based traineeship programs like this, because we need to grow our own and develop the workforce of the future for the long-term sustainability of the health service.